If you're building your ABA company and you're tired of guessing, this is for you. We built the EBCBA blueprint to give you real structure, systems, and support without the fluff. Details are in the description.
Let's go ahead and get started. We do these live streams, and the purpose is to make sure that you guys are getting information, eliminating some trial and error from operating your companies. So we want to make sure that you have what you need to avoid trouble, right? And avoid all the testing and trial and error that you usually have to deal with when you're starting a business or you're operating a business. It just becomes a real drag and very expensive on both time and money to go in and try to figure these things out yourself. So rather than you having to go out and hire a consultant for $10,000 or sign up for some crazy coaching program for $20,000, or hire a lawyer to put together these processes and procedures for you and pay them $5,000 to start your company, like, we want to give you the tools where you can go and do it yourself and not have to invest a bunch of money on the front end, right? And we also want to make sure that we're giving you valuable information that you can use to tweak, processes in your existing business. So, that's what these are all about. We don't monetize this group. We don't collect money from anybody, from the people watching these live streams or participating in the group. And we don't charge anything for our experts like Kay to come on and do these talks. The exchange of value there is strictly, hey, Kay, can you come on and teach our people something? Can you teach us something? Can you teach our group members something? Help us learn and get better at these little specific areas that you're an expert in. And while I do encourage you to go in and, schedule meetings to talk with people like Kay, to, bring her into your business and have her help you on a professional, within a professional relationship, hire these people, use them. But this is your opportunity to get to know those people and walk away from a conversation with them with some important, valuable knowledge that you don't have to invest anything but your time in. So that's the goal here. And we ask our service providers for our ABA businesses to provide this good information for us. And they put a ton of work in this. Wait till you see this presentation. It's obvious that Kay put a lot of time and energy into building this and kind of putting together this program for you guys. Kay is the founder of CredAlt. And today she's going to go over the guide for cracking the code on your ABA credentialing. So with that, I'd like to introduce Kay Ward. Kay, thank you for coming.
Thank you so much, Derek, for having me today. I'm super, super excited to be here and dive into the headaches of credentialing with everyone here today. So thank you guys so much for attending the webinar today. Today, we're going to be talking about cracking the code to ABA credentialing, how to streamline your credentialing processes, avoid delays, and just get better at credentialing. I know it can be confusing and frustrating, but we're going to break it down in a way that just makes sense. So by the end of this session, I hope you'll know how to make the process easier and faster. So let's just hop in. So my name is Kay, and a little bit about me is I've been helping doctors, therapists, clinics with credentialing over the past 16 years. I've seen all the problems that could probably slow you down, and I generally know how to navigate those issues. I learn new things every day, so I generally know how to fix most of the issues. And at the end, please feel free to definitely drop some questions in the chat, and we'll get those answered for you. So basically, I have experience in large healthcare systems, building credentialing workflows, and I am also the founder of CredAlt. What CredAlt is it's a real-time verification platform for you to be able to manage your credentialing and just do credentialing better. So what will you learn today? In this webinar today, you will learn how to fill out CAQH the right way so that you're able to maximize revenue and so that you don't get those headaches that payers are reaching out to you every second to try to figure out what you need to navigate that application. You'll also figure out how to complete an application with success, and also just how to navigate credentialing and to avoid mistakes that generally are causing you headaches and delays. So who's this for? It's for all of you guys that are new to credentialing, maybe new to ABA therapy. Even if you aren't new, this is definitely going to be for you as well. So yeah, we will definitely understand how to 10x that credentialing application. So next slide. So we have an interactive question here today. So if you understand the difference between credentialing and provider enrollment, I want you to answer yes, no, I have no clue, or if you're just here for the vibes. And you can drop those ones, twos, threes, and fours in the comments. Then we'll wait a little bit. I see some ones coming through. Please feel free to drop those ones, twos. If you know what credentialing is, yes. If you don't, no. Three, have no absolute clue. Or four, just here for the vibe. See some ones coming through, twos. Super, super awesome. Super awesome. Super awesome. See Lisa with the two. Courtney with the two. Perfect. So I think we got a few people that understand, some that have no clue, and some that are just here for the vibes. I'm also here for the vibes. So delayed credentialing can cost you a lot of money. Every day your credentialing is delayed, you're continuously losing money in that cycle. You can't bill insurance, which means there's no money coming through your practice. So that's why it's important to get it done right the first time. So we'll talk about a little bit about what credentialing is and why it matters for your practice. So what is credentialing? Credentialing is how insurance companies make sure you're a provider that is qualified. They check your licenses, they check your certifications, they check your work history and other details. So it's similar to like going to the DMV, they check you out, see who you are. That's the same thing that's happening with credentialing. Insurance companies need to make sure that providers are qualified before you guys can get paid. And it's also just a safety net for payers, for hospitals, for your employers. It's just a safety net for everyone to verify who you are. This is going to be your verification process. So what you'll also learn here today is what is the difference between credentialing and provider enrollment. So what we do from the provider enrollment side is actually get you credentialed with payers. That is going to be your provider enrollment side. And it's very important to understand the difference between credentialing, which would be your hospital focus or the things that an employer would do to verify you have a license and things like that. And provider enrollment is going to be what happens after that credentialing process. So you've onboarded to your practice or you're starting that practice. And usually what happens after that is we start the verification, the enrollment process of getting you enrolled with payers. And so what that means is provider enrollment is what happens after credentialing. And then once your provider is approved, they have to sign up with insurance companies that can bill for their services. So it's similar to like a gym membership. You can't just walk in and start using machines. There's no free trial period either. You have to do the sign up first. So that's exactly what provider is, just provider enrollment is, so to speak. So here's how the credentialing process generally works. You usually submit an application. You send in all the required paperwork, like your NPI number, W-9, and licenses. And then that takes you into the verification process. So your employer, a hospital, would be the one that's checking to make sure that everything is correct. So they verify your NPI, they verify your licenses, they may do background checks and similar things like that, just to make sure you're a qualified provider that wants to deliver excellent patient care. And then what that looks like after that part is you go through a committee review. So usually this is from the hospital perspective. You go through that review and then you're approved. So that's what we all work to get to, which is the approval. So our next process is going to be the actual provider enrollment process, which everyone cares about because that's how you get paid. So after credentialing, you need to enroll with insurances, right? So the first thing you're going to do is you're going to submit an application, and that application could be your CAQH account. There could be supplemental documents that are required by payers. You'll need to complete all that information before you're able to join an insurance network. So after you submit that application, payers have their own verification process, right? They need to make sure you are who you say you are as well. And they do that verification piece behind the table. And then next you have contracts. You agree to their payment terms. You receive those contracts. Usually that first contract, if you're a new practice or if you're just joining a practice, you usually would want to take that first initial contract that you receive. But I always let providers know to be advocates for yourself. So definitely, if you're able to negotiate any contracts up front, I would definitely say do that. And then after that, you receive an effective date. That's the part that we all want to get to. We all want to get to that effective date, and you have that contract in hand, and you're able to start billing for your patient or the services that you provide for your patient. So, what does it look like to actually master CAQH as an ABA professional? So, there are going to be key areas in the CAQH profile that you definitely want to pay attention to, because this is how you're going to be listed in provider directories. This is how patients are going to find you. So if they're looking for a specific demographic or a demographic of a provider, then you're definitely going to want to be strategic on how you complete these next couple of sections. And we'll get into what exactly CAQH is, and we'll also get into what, if it's not filled out correctly, how your application can get delayed. So you definitely want to make sure that everything is up to date with your CAQH so payers can process your credentialing accurately and as quickly as they possibly can. So why is CAQH even important? What is it? CAQH is not anyone that's credentialing you. I see these questions a lot. Like, I see CAQH is a credentialing service, but it's actually not. What it is a repository for credentialing data that payers, employers, hospitals can go out and pull your data. That's exactly what it is. It's just a repository for your information. And this is basically what the sign in page looks like. If you've ever been out to CAQH, you definitely know what this looks like. So, what are going to be the key areas in CAQH that you want to complete? You want to definitely pay attention to the specialty portion of the application, of the CAQH application as an ABA provider. You want to make sure you're filling out certifications, the patient groups, the gender identities, orientations, patient populations, and the issues that you treat. These are going to be key. I know a lot of people that skip over these areas because they are not marked as, they're not asterisks next to them, and it's easy. It's a super long application, right? You want to hurry up and get through the application. It takes about 2 hours to do. I know. It's super, super important that you pay attention to these areas so that patients can find you, because ultimately that's why you're going through the credentialing process, so that patients can find you and so that you can get paid. So you definitely want to pay attention to the specialties area. I know it's often overlooked, but it's super important. The next thing is going to be your practice locations. I know a lot of therapists that they practice at different locations, and sometimes all of those locations are not captured in your CAQH. And you want to be sure that that practice location is filled out, and it's filled out thoroughly. So if there's a section there under the practice locations that says how often do you see patients, you want to make sure you have that section completed. You want to make sure that the hours that you're at that specific location, for if there's a specific amount of days that you're at that location, you just want to make sure that all that information is completed. And if you have any specific credentialing contacts, you want to ensure that those credentialing contact area is completed, because if they cannot reach you, then they're going to reach out to your credentialing contact. So if you have someone that's specified that's going to be taking care of your credentialing. So I know sometimes husband and wives, they end up taking care of their significant others credentialing. And so if that is the case, you definitely want to have them listed, because they are going to reach out to who's ever listed. And we'll get into the slides later about what reattesting is and how important it is to keep up with your information and making sure that you're attesting that information on your behalf. And here's some more areas to complete. So employment info, there's a little mistake in the slides, but employment info is definitely going to be another area that you want to focus on. Also work history, which is the same as employment info. I can't remember if it's listed as work history or employment info, but you definitely want to make sure you pay attention to that area as well. And this is a super key setting in CAQH. I know a lot of people may have never seen it, may not know what it looks like, but this is actually how payers are able to download your data, verify your data. So if this setting is not turned on, you want to make sure that it's turned on today. So if it's not turned on, go ahead, log into your CAQH account. If you don't have one, go ahead and create one. It's completely free. You want to make sure that this setting is turned on, because what this does is payers are actually able to pull your information without reaching out and talking to you or sending you another email to say, hey, I need to download your data. You want to make sure that this setting is turned on, because it's super, super important for payers to be able to pull your data and making sure that that data is indeed accurate. So what supporting documentation do you need? You're going to need an NPI number. If you're going out into private practice, you're going to want to have your group NPI created. And then after the webinar today, I'll list some key resources that Derek and Josh can send out to everyone on the webinar today. And there'll be information there and resources where you're able to go out and actually create these things on your own or have someone do that on your behalf. You're going to have your license information, which is also in your CAQH as well. You're going to want to have that W-9. That is how payers are going to be able to pay you because they need to dot their I's and cross their T's as well. You're going to want to keep your CV and your resume on hand and make sure it's updated. And one key area that a lot of people forget is to make sure that your resume or your CV is in 2-digit month, 4-digit year. That's super important. You want to make sure that there are to and from date that you're listing on your CV and your resume, because it's super, super important. I've seen applications get kicked back for this, and I know it's a super minor mistake, but it will delay your credentialing if a payer is being super, super annoying. And you're also going to want your CP 575, and what that document is the document you receive from the IRS that basically confirms your tax ID number and confirms that you're a real business. For those that are going into private practice or even thinking about it, these are some of the supporting documentation that you're going to want to have. So please screenshot this page, and you'll get these slides after. But please remember, if you're going to start that credentialing process, these are definitely some of the major documents that you're going to want to have. And this is a freebie. You'll get a free checklist after this webinar to keep handy so that you have all the right documents readily available for if any payer were to. And avoiding common application mistakes. What we're going to talk about in the next couple of slides is the biggest mistakes I've seen. A lot of these things are common, but they are often missed. And what we're gonna talk about is how to avoid that and prevent any delays, or prevent as much as possible. Please complete every field that you see on the credentialing application. So when you start credentialing with payers, Aetna, Cigna, United Healthcare, you're going to want to make sure that if you are submitting any supplemental paper documentation, that you're completing even if you don't know the field, definitely if you can call the payer, if you can talk to someone, you definitely want to make sure that everything is filled out, because they will kick your application back. And make sure that the data on your application, any supplemental forms, are the same as it is in CAQH. So down to the address. If on the USPS site, it lists suite as SUITE versus STE, please ensure that it's listed the same way on your forms and the same way as CAQH, because I've seen billing be denied for these super, super annoying reasons, but there are regulations and laws around this now. So you definitely want to make sure that that information is matching. And that goes into address mismatches as well. You just want to make sure that all that information can be verified by the post office, and you want to make sure that that data matches. And make sure that if you're listing anything on your applications, that it's not outdated. So sometimes we forget about CAQH. We don't update the information there. We forget about it. We list whatever's at the current top of our brains, and we put that information on the forms. You want to make sure whatever you're listing on that application with supplemental documentation, it's the same thing that's inside of CAQH. It's super, super, super important. So how do you want to manage all these things, right? You need to, if you have multiple if you're licensed in multiple states, right, you have a lot of things to keep up with. You have no idea how you're going to do it. Right now, you're probably managing it in a folder on your desktop. That's why I built CredAlt. CredAlt is free. You're able to manage your licenses, and it's a completely free profile. And you have expiry notifications and things like that. So CredAlt is free, and you're able to manage that documentation and keep your information up to date. And how are you going to manage your CAQH? You need to be reattesting your information every 90 to 120 days so that payers have the most accurate, and not only payers, it's super important that patients have the most accurate data to them. Because what's happening now is ghost provider directories. People are unable to reach providers. I literally had my sister call her doctor the other day, and he was not even at that location anymore. So that's where the delay in care comes about, because patients don't have accurate data on providers, and payers are not even pushing that data out to provider directories as often enough. So if you can update your websites, your signatures and your emails, things like that, just make sure that information is up to date and you're reattesting that information in your CAQH every 90 to 120 days. I like to say at the beginning, if you think about a change, go into CAQH and make sure you're managing that. If you are seeing a new patient demographic, make sure that that information is in CAQH. If you're no longer accepting patients, make sure you're updating that information in CAQH. It's super, super, super important that you're able to do that. And make sure you're communicating with practice leaders, because one thing we do, life just comes at us fast. So you just want to make sure that everyone that needs to know knows. It's super, it's extremely important to be able to get that data across and ensure that everyone has accurate data available for you. And so now we're going to just jump into Q&A. Does anyone have any questions thus far? Any questions that we can fill and that I can answer? I'm definitely here to answer any questions that you have. So we're going to just open the floor for credentialing questions, any provider enrollment questions. You have a contract that you may don't know what it means. I'm completely open to answer any questions that you may have today.
Okay, I have one. What are your, and you went over a lot of things here to avoid some pitfalls, but what are your kind of your top three no-nos that you see happening that really cause the longest delays?
So the longest delays I see is CAQH not being reattested. That's going to be one. Another thing I see is providers not listing all their licenses in CAQH. So we have your telehealth providers, those that information is not in CAQH. And then they start the credentialing process and find out you have different licenses. And that slows down the process completely. Other things that I see that are super red flags are going to be when data does not mix match with CAQH. So those are a lot of the red flags that we usually see in today's credentialing world. And then the data just being inconsistent. Uh, Also, any gaps in your work history, you're going to want to make sure that you have an explanation for those gaps. So if you went on vacation, a sabbatical, or anything for 60 days, you're going to want to make sure that you're covering those gaps in your CAQH. And there's a space for that as well to be able to do that. So those are going to, those are going to be some of the major things. Now, they do have their own process and plans on what they need. So some of the payers are a little bit different, but those are going to be like your major things to watch for as an ABA professional.
So tell us about the CredAlt solution and how that works.
Yeah, so CredAlt is a real-time verification platform, and we actually launched about 2 weeks ago. In CredAlt, you're able to manage your profile, share your data. So one thing that we're trying to decrease is provider data duplication and provide real-time information. So what CredAlt does is you're able to track all your licenses in CredAlt in real time. You're able to share your profile instead of submitting information time and time again. So you may need to credential with your employer. You may need to credential with payers. All you have to do in CredAlt is actually copy a link and you're able to share that information in real time instead of going out looking for all that information. You're able to keep all your data in one place. So that being immunizations, your W-9s, all can be uploaded in CredAlt and you're able to manage that in real time. So what that does is decrease providers having to communicate with multiple people, your employers. So you just drop that link and they're able to download all the information that they need.
That sounds awesome. All right. So Lisa has a question. She says, so CAQH is only for the individual providers trying to credential with a practice?
Yeah, Lisa, good question. So actually, CAQH is for all providers. So if you are an individual provider, you're going to be required to have a CAQH. Now, credentialing with the practice, your practice may, if you're joining a practice, they're going to want you to have a CAQH account because it's almost the only way that you can get provider enrolled. And what that means is making sure that you're getting enrolled with payers. So the practice is not going to have like their own individual CAQH. It's the provider's responsibility to be able to have that CAQH, manage it, or if you're joining a practice, they usually will manage that for you. And then what you'll have to do is share your username and password, which is a no-no usually, and that's where CredAlt also saves that space as well. You no longer need to share your username and password where you're giving anyone access to your data. You're able to get a link and share that information only one time, and there's a 30-minute token. So with all the data breaches and everything, you want to be careful about who you're sharing your username and your password with because there's been so many breaches in healthcare, and you just want to be careful what you're doing. But yeah, going back to that question, CAQH is for all providers. And if you're getting credential or joining a practice, yes, you are going to need a CAQH account. So hope that answers your question, Lisa. That was a very good question.
So how does CredAlt work between, so a lot of the ABA providers, I'm sure you know this, that they have, billing companies that are kind of helping them handle their credentials. Is there a way to kind of use CredAlt as a bridge between the ABA provider and their credentialing specialist that's outsourced? Like, because that's really
Exactly.
useful. You have a lot of
Exactly.
passwords going back and forth. I see that a lot.
Exactly. Like that is a super good question and call out, Derek, because with CredAlt, you no longer have to share your username and password, and you're able to share with your billing company. You can even track enrollments and submit enrollments in CredAlt. So if you're a billing company, if you want to streamline billing companies, if you are here, you can also streamline your processes with CredAll, and you're able to manage those enrollments in real time. So a lot of time I get therapy providers and they're just like, I don't know who I'm credentialed with. Well, you no longer need to not know because you can track all this information inside of CredAll as well, because you're gonna sometimes you don't stay with the same practice. You want to go out, branch into your own. You don't know who you're credentialed with when you leave a practice, and it's super important if you can be able to track that information. So you already know who you have a at least a standing application with. Now you're gonna have to go through the process. You're not just credentialed as a one all be all. So if you leave a practice, you're gonna have to go through another credentialing cycle. That's just the way our healthcare works. So you're going to have to get re-credentialed. You're going to have to get re-enrolled with payers. So yeah, that definitely our CredAll billing can streamline processes between billing companies, employers, and payers. So that's what we're striving to do and decrease data duplication. And the profile is completely free for all providers as well.
Yeah, it's a huge vulnerability you're solving there too. I don't know if you really even realize how big that is because there are so many so many ABA providers that are just emailing a username and password to their billing company and they're logging in and doing all this. That's a really great gap to fill. I think we should set up a demo for the CredAlt just so everybody can see how it works.
Yeah, do that.
So
Yeah.
for sure. All right. So Dulce asked, when uploading licenses to the CAQH, can we submit screenshots of the website where the license was obtained, or should it be, or does it need to be the official license document?
It's going to have to be that official license document because some of our payers are very old school and this is very antiquated, but they still require you to upload that official license document. Now, if you're enrolling with some of our managed Medicaid plans, so if you guys have ever tried to credential with Aetna Better Health, that's going to be a managed Medicaid, and they may require you to upload and have that hard copy license. And for some payers, this is still a hard stop when I don't really know why, when they can just go out to the site and verify it on their own. But literally, they will still ask you for a hard copy of your license. They will still ask you for it. So yes, they'll say it would definitely benefit you to go ahead and upload that official license document if you have it readily available. It'll save you so much headaches and it will decrease your communication with payers.
Awesome. All right. So Nicole has a question. I've heard this one several times about the CAQH, but her question is, she currently works for a small company and she's looking to branch out and open her own clinic. Congratulations, Nicole, by the way. That's what it's all about. For a while, she plans to still work part-time with her current employer, and she wants to know if she needs to have separate credentials when she goes out on her own.
Yes. When you start to credential and create your practice and you want to start seeing patients on your own under your information, so what you'll be is individually credentialed unless you decided to create a group. So you're going to have to start the credentialing process all over again under your individual NPI. And if you decide to get a group NPI and a group tax ID number, you will be credentialing under those as well. There are some providers that just get individually credentialed and bill under their social security number where they use that as their tax identification number. But that's just like a business decision that you'll have to decide. But yeah, you definitely will have to start separately credentialing when you go on your own. So if you're looking to do that within the next 120 days, you definitely want to start that process as soon as possible so that before you leave your practice, you're already good and ready to go, because it is going to take you about 90 to 120 days to be credentialed. Now that's modest, but that is usually the typical time frame that it's going to take for you to be credentialed with most payers.
Awesome. So Nicole says, thanks, that helps. And she's still early in the process setting up the LLC. And I just want to insert my own thoughts here for a second. Nicole, anybody who's starting your business right now, be very careful where you are investing your startup money and your time when you're starting up the business. I have a lot of people who reach out to us and say, hey, I just paid a lawyer $5,000 to set up our LLC and build all of our policies and procedures. Please don't do that. Please save your money. Please, most of these things that these lawyers are putting together are things that you can do yourself, and a lot of it just ends up being wrong because you set up your policies and procedures before you have a contract. So there's things that need to be in those policies and procedures based on those contracts. So just a quick thing, if you want to talk to Josh or myself, just reach out to us and we'll do like a kind of a startup session. And we never charge anything for that kind of stuff. Nicole, anybody who's starting up right now, definitely reach out to us about this. Nancy asked, is it faster to get credentialed with a new provider if you're already credentialed with an existing provider?
Great question, Nancy. Actually, the short answer is going to be no. Unfortunately, and I don't want to give you guys any kind of I want to be super real with you guys. So the short answer is not going to be a quicker process. Now, the payer may have some of your information readily available, right? But you're still going to have to be re-credentialed with, or I don't want to get the terms mixed up, but it's easier just to say credentialing because everybody understands what credentialing is, but it's actually provider enrollment, what you're going to be doing. So definitely it's not faster at all. You're gonna still have to wait that maybe 60 to 90 day time frame because they do have a lot of your information readily available. But now what they have to do is credential you with the new practice. So yeah, it'll still be about 60 to 90 day wait time. I wish I
Awesome.
could make it faster and hack or something, but I unfortunately can't.
It's a highly bureaucratic process, and no one's in a rush to get it done except for you.
Yes, I am super in a rush here. Great comment. Super in a rush to get that done because I mean credentialing has just been a headache for so many people for such a long time with no real reasons of why it takes so long, especially with stuff that is supposed to streamline that. So I think everybody that are going out into their own practices, kudos, but definitely get started with credentialing as soon as possible. It's just super, super important to get everything in so that you can start building right away.
That's awesome. Yeah, okay, thank you so much. This has been super informative for me. I can't imagine how the ABA owners feel about it. I mean, this is, important information. And I also really look forward to a CredAlt demo because the gap that's being filled here between, empowering business owners to outsource and do it safely and in an organized fashion where you can see what's going on, you understand what's happening, a safe way to share your usernames and passwords, credentials, right? So credentials in the credentialing process, but I think it's a really important gap that's being filled here. So I look forward to that. Anybody else have any other questions?
Yeah, I'm
Yeah.
an open book. If you guys have any questions, none are too simple, none are too hard, I hope. If I don't have the answer, I definitely can try to get an answer to you guys.
And this recording is going to be posted on the ABA Business Challenges group on Facebook. That's where we always put them. So if anybody's not on the Facebook group yet, just search us up, ABA Business Challenges. And Tanya just asked if there's any chat groups out there for people starting their own businesses to connect and help each other out. Yes, it's the ABA Business Challenges group. There's also separate chat rooms on there where you're talking about specific things. We have everything from RBTs to BCBAs, taking exams, credentialing discussions, startup discussions, all that stuff. So, and if you guys are starting up, we kind of have our little program together, your like kind of basic checklist from a business organizational side. So book that with us. It's free. Kind of getting everything set up from your emails to your website to putting all this stuff together yourself and make sure you're giving yourself a good foundation to scale from, right? So for sure, Tanya, there are some chat groups on there. And if anybody's not in the group, it's free to join. It's not monetized. Jump in there and start learning. And stay tuned in for the recording of this webinar and also for Kay to come back and do a nice little demo on CredAlt. I'm pumped to see that. So again, Kay, thank you for your time and your deep knowledge and expertise on this. Sure, it's been a big help to everybody who got to attend here.
I am super happy to be here. And you guys, we have some other sessions that are scheduled going into some contracting things. And it's going to be really great to get deep down into those contract terms and understanding what they mean. And Derek and Josh, thank you guys so much for having me today. It's been wonderful to be able
Awesome.
to share some of that
Yeah.
knowledge and just answering these questions. I love being a part and being able to do things like this.
I love talking to people on these webinars or live streams or wherever we are who you just know it. Like you're an expert because you could wake Kay up out of a dead sleep and she could just answer these questions for you. She lives and breathes it obviously. So really glad to have you here as a part of our group, Kay.
I am super amazing. And I love what you guys are doing, helping ABA professionals be successful. And just like you said earlier, please don't pay anyone $5,000 to do those things that Derek and Josh can happily help you guys do for no cost at all. So, and
Keep
just
that money. Don't go into debt.
yeah, and just being active in the group and get a lot of your questions answered. So you guys, please make sure that you are out there in the ABA Business Challenges group and they can answer a lot of those questions and things like that, and being able to book a session with Derek and Josh so that they can share their expertise as well, helping you guys get started up.
Awesome. Well, thank you, Kay. Thank you, everybody, for attending. We love you guys, and we'll see you all in the group.
Thank you guys so much. Have a good one.
You're already doing the work, investing your time, your energy, and your vision. So let's make it count. Build something that works without breaking you. The EBCBA Blueprint is the way. Get started for free with our foundation course.